Today I just heard somebody saying, that so and so person, my friend, he was just 30 years old and he had a heart attack. And now he's in the hospital, he's in the ICU. Really? But he was just 30 years old. How can it be? Greetings, I'm Dr. Usha.Dane, a practicing physician and a diabetologist from Johns Hopkins School of Medicine, Baltimore, US. Age has no limits. Your life at present has no limits. All over the world, 30% of people are having heart disease, are having heart problems. In India, 9,000 people are dying because of heart disease. So how is that? Who is the culprit? I'm walking, I'm doing a lot of exercise. I do gym every day. I walk, I do weight training. I'm taking care of myself. I'm not taking sugars. But then why am I having a heart problem? And how do I know if I'm having a heart problem? My heart is weak. How do I know it? It is not shown on my face. I'm not looking sick. I'm looking fresh. What about my heart? My heart is inside. It is just the size of my fist. How do I know whether I'm keeping a healthy heart or no? Very simple. Keep a track of your BP, your blood pressure. Similarly, you have to do a blood investigation. That is the lipid profile. When you do your lipid profiles, you come to know the level of your cholesterols and your triglycerides. The lab people will say, or on the investigations reports, it will say that it is less than 150. But as per my knowledge, I always say it should be 100 or 110, not more than that. So your triglyceride levels have to be less than 110. Do your blood investigations. When do I start doing my blood investigations? Now I'm just 28. I'm just 20. What should I do? Well, at the age of 20, when your life begins, when you have graduated, you should see that you do your lipid profile. So you come to know the condition of your heart. You know your cholesterols and your triglycerides and where you are landing. From where does it come? Only 10 to 15% of this triglycerides and cholesterols, they are being produced in the liver. As I said, the remaining it is coming from the diet which you eat. What about my ghee intake? Somebody said, I can have a lot of ghee. Ghee is very safe. If you go to the olden ages, they were having butter. They were not having ghee. The gas was very less. It was not there at all. So they were taking white butter, not ghee. When you take ghee, check for yourself. See your blood, check your lipid profile, check your triglycerides. If they are normal within the limits which I have said, then it is okay for you. But if they are on the higher side, ghee is also a big culprit for your heart attacks. It is a wrong notion given by some people that you can consume as much ghee as possible. It is not so. Blood investigations, your triglyceride investigations, your cholesterols will show you whether you are in danger limit or no. When does this start? This starts at the age of 20. An heart attack will never say that I will come only at the age of 60. It starts from the age of 20 when you are out of your comfort zone, when you are out of your house, when you start earning, you eat a lot of junk food, you are not taking care of your diet, you are not having home cooked food. The outside food is having lot of oil. All types of oils are not allowed. It has to be in moderation, it has to be in limit. How do I know whether I'm going to get an attack or no? People mislead hyperacidity. It is just an hyperacidity. I think it's not an attack. If you have frequent hyperacidity, your acidity is there frequently, every now and then after eating any small things, Get yourself checked. This is the first sign your heart is telling you that it is not your acidity but your cholesterols and triglycerides which have increased, which is causing this indigestion problem. What is the intimation your heart gives you? It clicks, it gives you a very fine intimation. There is a choking pain. It is like somebody pressing you. It is like giving you a tight hug. How somebody hugs you? When it is slight, you don't mind. But when a person hugs you very tightly, you tell him, oh, leave me. So that hug, which is there constantly for some time, it is not leaving you at all. That tight feeling in your chest, in your upper body, this hug, when it is there, that is an attack. Your heart is choking. Your heart wants oxygen. It is breathing. It is trying to fight. This is the sign when your arteries are getting choked because of this triglycerides and your cholesterols. You need immediate treatment. Go to your doctor. Get yourself checked. See your cholesterols and your triglycerides. They are the main culprits who are making you land up into an heart attack. They will not see your age. They will not see whether you are doing any exercise or no. They will not see whether you are rich or poor. Heart attack can attack everyone from small to big and in all the type of countries. It is always better to be cautious, safe, do your investigations and take your treatment. Subscribe to my channel and press the bell button.